Gram-negative rods, however, anaerobic gram-negative rods are far more common. So really kind of the take home from this anaerobe chapter is we don't often see anaerobic cocci, gram-positive or gram-negative, but we do commonly see anaerobic rods. So here are some of our gram-negatives. We're not necessarily in this section going to break them all out by genus. We may mention a genus every once in a while, but a lot of them will cause similar types of infections. So we kind of just group them all together. Bacteroides fragilis is one of those species of bacterium that can cause fairly significant infection. They are what's called pleomorphic in size and shape. So even if you have a pure culture of Bacteroides fragilis, if you look at them under the microscope, some of the cells might be large, some of them might be small, some of them might be rod-shaped, some of them might be a little bit more round, but they're all the same species, which can make it difficult to diagnose via microscopy. They grow relatively rapidly, especially when compared to some of those gram-positive anaerobic rods. They can have a capsule, and they tend to have very little endotoxin activity. So even though they're gram-negative, they do have LPS and they do have lipid A. It tends to not stimulate the immune system like we see with the lipid A of some of our other gram-negatives. Gram-negative rods generally have a lot of the same virulence factors, including adherence using fimbriae, those hair-like projections from the surface of the cell. One species, Prophomoris gingivalis, which normally can cause oral infections, actually has a virulence factor that it can induce pro-inflammatory cytokines. And we've talked a little bit about this before. It seems kind of counterintuitive. I'm a bacterium. The immune system can clear me. I should hide from the immune system. But what we see in some of these cases is that I'm a bacterium. The immune system can kill me, but I'm going to turn it on anyway. And you get the production of these pro-inflammatory cytokines. And what ends up happening is you get a lot of localized tissue damage. And sure, maybe some of the bacteria will be sacrificed, but a lot of that inflammation and that localized tissue damage can actually be beneficial for the bacterium. So again, some of these species do have capsules, not all of them. Capsules are very helpful because they can promote attachment, but they can also prevent phagocytosis. Some of the genera are able to degrade antibodies. They have proteases that will allow them to break down antibodies, which help them hide from the immune system. And they have enzymes that allow them to detoxify reactive oxygen species. This is kind of weird. A lot of our anaerobic bacteria are anaerobic, or even some of our microaerophilic bacteria. They're in these environments, and they've evolved to these environments that have little to no oxygen, often because they cannot detoxify reactive oxygen species. Because they can't detoxify reactive oxygen species, they can't be around oxygen. So it's kind of unique that some of these anaerobic gram-negative rods actually produce catalase and superoxide dismutase. They are able to deal with reactive oxygen species, yet they still choose to not, I shouldn't say choose, they're bacteria. They still have not evolved to grow in oxygen. So there must be something else about an aerobic environment that inhibits their growth. But in this case, it is not the production of reactive oxygen species. Bacteroides fragilis can cause diarrhea. It has a toxin that can lead to chloride secretion, fluid loss, and IL-8 secretion, which can exacerbate that fluid loss and leakage. These bacteria colonize the human body in really large numbers. They are super common residents, especially of the large intestine. So a lot of the bacteria in the large intestine that we know about are things like E. coli, some of these facultative anaerobes, but really a huge amount of the bacteria in the large intestine are actually anaerobic gram-negative rods. And they have a lot of beneficial functions. They prevent colonization by other pathogens, they help us digest our food, and they teach our immune system how to work. So we have to have these bacteria living in our large intestine. We really just want them to stay there. The problem is when they leave. They can spread because of trauma or disease and colonize other areas. So any sort of injury to the intestines, a disease that has caused perforation of the intestines, can allow these bacteria to leave the intestines and to colonize other areas of the body. And that's where we have significant issues. They are associated with infection of the sinuses, the ears, and nearly all periodontal infections are caused by anaerobic gram-negative rods. The Pophomonas gingivalis and Prevotella are two organisms that cause a lot of issues in periodontal disease. And if left untreated, brain abscesses can result from chronic ear or sinus infections. We can have a lot of intra-abdominal infections, so when they escape the GI tract, and so that's what they're showing you in the upper right image. That is a patient with liver abscesses. This picture is a patient who had to have all of the skin removed. This is an intra-abdominal infection as well. This is a male who had to have a lot of surgical debridement of this area. Can cause gynecological infections, including pelvic inflammatory disease, abscesses in the uterus and other tissues in those areas, endometritis, surgical wound infections, and then this is a skin and soft tissue infection. Can also get into the bloodstream and cause bacteremia. They can sometimes cause gastroenteritis or inflammation in the GI tract. That would usually only be if you had a slight overgrowth, but they were still contained in the GI tract. Most commonly, the majority of patients are never going to know about these bacteria because they're not ever going to cause a problem. But in any situation where you might have had a patient who had any sort of trauma to the urogenital system or to the gastrointestinal system, these are types of infections that can be of significant concern. Microscopy can be useful because you will identify gram-negative rods. They do grow relatively quickly, so you can culture them, but just remember you always have to culture them under anaerobic conditions. So if anaerobic conditions aren't met, you're out of luck. Bacteroides grow pretty rapidly. Within 1 day, you'll see colonies on a plate. For the others, 2 or more, but again, that's not that slow. That's pretty good. You can do the 16S rRNA sequencing, but in a lot of these cases, again, if you have a patient who has liver abscesses, you kind of want to treat them right away instead of waiting for sequencing. So this could be something that you would do in the meantime after beginning treatment. Treatment, though, can be complicated. They are resistant to penicillin. So one of the first questions I asked you in the class on your very first quiz, what is the relevance of knowing whether or not a pathogen is gram-positive or gram-negative? And I asked you for the clinical relevance. Here it is. Many gram-negative bacteria, because they have 2 membranes, are inherently resistant to penicillin and other cell wall inhibitors. Not all. Some cell wall inhibitors do work against gram-negative bacteria, but many do not. So that's why it can be important to know gram-positive versus gram-negative. Metronidazole, which is, again, that antimicrobial compound that works against anaerobes, is good. It will work against these bacteria. They are anaerobes. Carbapenems are a class of cell wall inhibitors that actually do work against gram-negative, so these would be helpful as well. So if you suspect an anaerobic gram-negative infection, this is the line of treatment that you'll want to follow.